Hi, I'm Scott Porter. Older adults and people with disabilities are some of our most vulnerable populations in times of emergency, and you'll definitely be seeing them in a disaster resource center. Today, you'll hear from a couple of experts who have a combined experience of 33 years in caring for older adults and people with disabilities. Irma Jimenez of Multnomah County Aging, Disability, and Veteran Services, and Lisa Sadowski from the Area Agency on Aging and Disabilities of Southwest Washington. They're going to share their best resources and strategies with you so that you can be confident in providing safe, compassionate, and effective care for older adults and people with disabilities in an emergency. Don't forget, we've also got segments in this series on intellectual and developmental disabilities, chronic illnesses, behavioral health, and effective communication, as well as other tips to help you work in a disaster resource center. Okay, let's go see our experts.
Hi, I'm Lisa Sadowski, and welcome to my office. We have quite a few older adults in our country, more all the time, and about 20% of the population has some form of disability. You can imagine these populations overlap quite a bit. A lot of older adults have disabilities, and they may need assistance with activities that we sometimes take for granted. Older adults and people with disabilities may also need information, shelter, or access to health care. So here are some key points to keep in mind once they get to the DRC. First, and this one is very important, be sure to treat adults like adults. Too often people talk to older adults and people with disabilities the same way they would talk to a child. Be aware of the tone of your voice and allow people to speak and make choices for themselves. Next, emergency situations are stressful enough, so we need to do what we can to protect one another's dignity. You might remember that from our values and guiding principles segment. We also need to be respectful at this delicate time during an emergency. Older adults and people with disabilities often face social isolation and trauma in their daily lives. Allow them to voice their needs. Not only is this another way to protect their dignity in a time of stress, but it's also a safety issue. People aren't always vocal about their needs. In these scenarios, use a look, listen, and link approach to connect with people through basic needs, like you may have heard about in the segment on trauma-informed care. Don't approach them empty-handed. Bring a snack or a glass of water and ask if they are hungry or thirsty. Give them the opportunity to say no or express other needs.
Hi, I'm Irma Jimenez, and welcome to my office. We also need to focus on communicating so that people understand. Sometimes I need to find ways to say things differently, sometimes without actually talking. If someone's hard of hearing or deaf and there's no interpreter, you might need to write things down. Adults with cognitive disabilities can have a hard time with complex messages. Keep it simple and be patient. Trauma can cause confusion in general, so watch for visual cues and check that the person you're speaking with is really understanding what you're saying. Finding your way to a DRC may be a struggle even as a staffer, and then once you get there, it still might be hard for you to get around inside. Think about how guests will be able to access your DRC. Are there ramps in and out of the building? Are the doorways large enough for wheelchairs or walkers? Are there good restroom facilities for people with disabilities? Is there a place to plug in life-sustaining medical equipment? Does anyone need to get to a hospital? And do people have the medications they need? These types of questions are being considered when selecting the location, but sometimes we have to work with what we have. So keep these questions in mind, and you and the DRC coordinator may have to think about how to make the facility accessible to everybody. No matter what we do in setting up our DRCs, there's probably going to be someone who'll need help from another person with their day-to-day activities. Approach the conversation respectfully. Check to see if a caregiver came with them and try to connect them if they've been separated. If they need a caregiver, gently ask some questions about the kind of assistance they need, and please inform the DRC coordinator. Don't be afraid to ask what somebody needs rather than jumping to conclusions. They are the experts in their own lives.
Finally, I wanted to mention that older adults and people with disabilities often have lots of experience and skills, and they can be an asset to the community of the Disaster Resource Center if you can find a role for them. If we, the DRC staff, don't engage, it's easy for our guests to feel disconnected and alone after a traumatic event. Keep an eye out for volunteering activities to get our guests connected with the community inside the DRC. All right, that's what I have for you today. We looked at some of the particular challenges and even advantages of older adults and people with disabilities in a disaster resource center. Mostly, I just want to encourage you to be willing to ask people about their needs, to treat people with respect and dignity, and to involve them in the DRC. Don't forget that we have a whole series of training all about operating a DRC, and you're welcome to check out our other topics as well. Thanks for watching.